General characteristic of infectious with airborne mechanism of transmission. So today is a lecture about influenza and acute respiratory virus diseases. Influenza and acute respiratory virus diseases occupies the first place by amount of causes of disease in the world and make annually 95% of all infectious disease. Influenza affects annually 50% of population of the planet. Acute respiratory viral diseases, or ARVD, is collective name of major number of respiratory diseases caused by more than 100 viruses. What has allowed to unite them in one group? All they are of viral etiology, primary injury and epithelium of upper respiratory tract, also are accompanied by intoxications of virus expressiveness, spread from person to person by aerosol or droplet transmission, meet everywhere, can cause epidemics and pandemics. You could talk about influenza A or COVID-19. Among this group of disease, the main role belongs to influenza, or belonged. The name of disease comes from French word grippe, to attack, to seize, from a Latin word influenza, to invade, to flow into. The virus of an influenza A is allocated in 1933 year. A virus of influenza B is located in 1940 year. A virus of influenza C is located in 1947 year. Family Orthomyxoviridae, gen Myxovirus influenza. A spherical virus by size of 120 nanometers. The core contains one filamentous RNA minus divided on 8 fragments, which encoded to formation of 10 viral protein and united among themselves by common protein envelope M1, formating a nucleocapsid. Convert bilayer by the lipid envelope on the surface with two main antigens, H and A of virus, are detected. So this is how it looks like. Matrix, protein membrane, RNA segments, nucleocapsid, and so on. It has internal proteins and external neuraminidase and hemagglutinin, which causes a name, and extranuclear proteins and RNA minus divided on 8 fragments, size of the virus 100-120 nanometers. Again, hemagglutinin and neuraminidase are on the surface and different other proteins in the core. On the microscope, again, influenza affects a lot of species of mammals, from cats, tigers, and even whales, to pigs, cattle, and human. They have different their own antigens like H and A, and human usually have 1, 2, 3, or it depends. When it's mutated, we have something new. So for human, H1N1, H2N2, H3N2, and so on. And this is mostly that nowadays considered to be a bird, but sometimes human may be infected too. Hemagglutinin have 15 types. 1, 2, 3 for the man, provides affection of a virus to the cell. Neuraminidase have 9 types. 1, 2 for the man, provides infiltration of a virus into the host cell and infiltrating going out of the viruses, the sentence from host cell preventing their aggregation. The nuclear protein as antigen has to constant structure, also determines the type of the virus, A, B, or C. Hemagglutinin and neuraminidase, the antigens permanently chargeable, also determine appearance of the different strains one virus, influenza A and B. The virus of an influenza A permanently varies, causing epidemics every 2-4 years. There is a drift. Again, antigen drift is small mutation. Antigen shift is big mutation, changes of the whole hemagglutinin or neuraminidase. And that causes completely different type of virus. But every 10-30 years, there is a complete replacement of antigens like shift that promotes by appearance of pandemics. The virus B varies slowly, epidemics through 4-7 years, but shift is not observed, so pandemics do not arise. The virus of influenza C does not change antigens, contains only 7 fragments RNA instead of 8 and 1 surface antigen instead of 2, supporting only sporadic case rate. The replication of a virus occurs in cytoplasm of a ciliated epithelium, but the synthesis RNA occurs only in a core to using RNA transcript of the host cells. Unstable in external environment are perished. At 20 degrees through 9 hours and 60 degrees through 5 minutes. At boiling, attacks on alcohol, bichloride of mercury, formalinium, disinfectants is instantly. At fast freezing, like minus 70 degrees, can survive for years. Epidemiology. Source: a sick man 20 hours prior to illness and all acute period. Mode of transmission: airborne, aerosol or droplet. Epidemics of influenza A are recorded every 2-3 years. Duration for 1.5 months with effect up to 50% of population. The pandemics are recurred every 10-40 years. Epidemics of influenza B are recurred through 3-4 years. Their duration 2.5-3 months, with effect 25% of the population. At influenza C, an only sporadic case rate. Again, it's a type of influenza that causes epidemics in different years. So this subtypes, stems, so on. Every 11-42 years, average every 3 years, we have these outbreaks: H2N2, H3N8 in 1918, and H1N1. In 1977, again H1N1, young people who were born before 57 got sick more often. And in 2009, we had H1N1 again outbreak. I guess it's an old data about the last big pandemic of H1N1, bird flu, avian flu. You see, it was rather, well, pandemic. It's all over the world was registered. The reservoirs may be, again, mostly birds, but they contact with other animals. And again, birds, swine, horses, even whales. And all get in contact, and sometimes this causes mutation. And again, this slide was present already. Epidemics arise autumn and winter, northern hemisphere, spring and summer, southern hemisphere, the year-round along equator. The level of a case rate depends on number of population of city. If 1 million and more acute respiratory virus is 29%, of influenza 11%. The less the population, the less the cases. Like it is less than 500,000, the cases is 22% approximate, and influenza 9 and 7%. The village inhabitants got sick less often, less density of population. Duration of post-infection immunity. At influenza A, 1-3 years, influenza B, 3-6 years, influenza C, all children have immunity to 8 to 10 years of life. Pathogenesis. The virus gets on mucus with a ciliated epithelium, nose, trachea, overcoming its protection with viscous slime, constant emotion of vials of its ciliated epithelium, absorption of macrophages, secretion of mucus immunoglobulin A, overcoming effects of interferons, then attachment goes. With help of hemagglutinin attached to receptors of celiac acid of epithelium upper respiratory tract, with subsequent implantation in cells of an epithelium and coating of a virus, beginning of replication with creation of the virus descendants. One cycle of replication lasts 4 to 6 hours. In 24 hours from one virus, there are several hundreds, millions virus and descendants. Again, virus goes to cell, uncoating there, multiplies, and then it's release more viruses. Again, another page, another picture. So again, it goes to cell, and then multiplies with much more viruses getting out of it, and mostly it's trachea and nose. Exit of the virus's descendants and damage of new host cells. Core and protein of a virus are shaped in cytoplasm with subsequent access through the enveloped cell, transmuting in a part in its own. Final creation of a virus occurs on the surface of a cell, then a virus descendant introduces into a healthy host cell. The neuraminidase at this stage plays an important role in impeding aggregation of the virus descendants and them going out from a cell. The left by virus cell enters the stage degeneration, but the link with the basal membrane mucus survives 1-2 days. That results to restart apprehensive scatterol of a syndrome. The hypersecretion mucus only start on second day. Appearance of viremia and toxemia from the first hours of disease. The expressed toxicosis distinguishes of an influenza from other acute respiratory virus disease. The toxicosis results to infectious toxic shock, toxic edema lungs, brain, cardiovascular insufficiency, damage of adrenal glands, damage of the liver and kidneys, diarrhea, oppression cellular of immunity, and phagocytosis, and always causes immunosuppression. Reconvalescence and creation of immunity, elaboration and interferon and activation T killers, reinforced shaped immunoglobulin A mucus and then immunoglobulin G. The antibodies are produced not earlier of the 7th day. Pathomorphology, a typical current of change it are found out only on mucus covered by isolated epithelium, nose trachea as its desquamation. The necrosis considerably exceeds sites of visible inflammation. The secretion of an epithelium is reduced, dryness of the mucus. Restoring mucus starts with 3-5 days of illness with derivations static-filled plain epithelium, which only for 15 days is situated on ciliated. Immunosuppression and bacteria slow down this process. At severe current, the necrosis become numerous. There is lymphatic infiltration and hemorrhagic syndrome with damaged lungs, brain, myocardium, total damage of all capillary network. Classification of an influenza. For the term ABC, for type A is underlined the type hemagglutinin and neuraminidase. On gravity of current, mild, middle, severe, and fulminant, hypertoxic form. The typical forms of an influenza without a fever or without an inflammation of upper respiratory tract. Presence of complication stipulated by a virus, hemorrhagic pulmonary edema, false group, edema brain, arachnoiditis, polymyeloradiculitis, glomerulonephritis, myocarditis, syndrome of sudden Morse, Rey syndrome is more often in H1N1, or stipulated by affection bacteria, antigens, pneumonia, sinusitis, otitis, pharyngitis, etc. The example of diagnosis: influenza A, severe form, complication, myocarditis, purulent pansinusitis. Incubation interval, some hours to 2 days, actually up to 5 or even 7 days, so we talk about avian flu. Major clinical syndromes of an influenza: syndrome of intoxication, Cattrall syndrome. Acute beginning, fever up to 39-40 degrees, hyperemia of the skin, injection of vessels of sclera, headache in frontal areas, myalgia, arthralgia, expressed weakness, losses of appetite, source, pain of eyes, dry painful cough, tearing, photophobia. The high fever keeps 2-3 days, then it's reduced, but the cough amplifies and for 7 days, sometimes up to 1-2 weeks, and escaped. For influenza A is typically intoxication, violation of consciousness. For influenza B is typical damage of nasopharynx and eyes. Frequency of cyclic influenza, chill and fever up to 100%, dry painful cough 50-75%, headache 50-75%, pharyngalgia 50-75%, prostration 26-50%, stiffness of nose 26-50%, diarrhea is more often H1N1, 26-50%, giddiness up to 25%, myalgia up to 25%, vomiting up to 25%, irritation and pain in the eyes up to 25%. even with meningitis is here. Again, this is redness of the eyes, injection of sclera, redness of the throat due to vessels, vessel hyperemia. Again, eyes. It's uncomplicated influenza, 3 days of temperature, and then normal temperature and just coughing. It's X-ray in influenza. It's interstitial pneumonia, as I may see here. Usually, often influenza proceeds thus, but can proceed in a typical form or at the inadequate immune answer and low level of interferons in the blood develops the hypertoxical forms with neurotoxic, hemorrhagic edema lungs, infectious toxic shock, edema brain, and without adequate treatment to result in death of the patient in the first day of illness. Diagnosis: virologic inspections, mass from a nose and stomatopharynxes with the subsequent cultivation of culture cells for chicken embryos. It's rather seldom. Usually it's only just when we try to find some new stamps. Usually we use just nowadays PCR. Reveals of an antigen in smears with mucus, blood, CSF, usually antigen smears from mucus. Immunological research: ELISA, RA, RPHA, RN, SFE test on the first and 7th 14 days of illness, a 4-fold increase of antibody therefore, and after an interval 1-2 weeks, confirm diagnosis. But usually just we use rapid test for influenza and then PCR to confirmation of diagnosis. On this, IFM, infection smear express diagnostics. Sorry, X-ray of the lens, plating and microscopy of sputum. White blood cells, leukopenia, lymphomonocytosis in CBC, coagulogram, hemorrhagic syndrome in severe cases, in complicated cases. In moderate severity, no changes in coagulogram. X-ray examination may show viral pneumonia at early stage and bacterial pneumonia at late stage. Treatment of influenza: antiviral therapy. In the first place, oseltamivir 75 mg per orally every 12 hours for 5 days. Rimantadine 300 mg the first day, then 100 mg every 12 hours, 3-4 days. Ribavirin 200 mg every 6-8 hours, 3-4 days. Arbidol is used only in Russia. Maintenance therapy: apply of interferon in a nose, application of anti-flu immunoglobulin for 3-6 milliliters per day. Inductors of antigenic interferons sometimes may be used. Antibiotics for old men, attenuated children, old 6 months, and a bacterial complication. Again, we at least check CBC, maybe if some leukocytosis or shift to the left may be there, or just when we see changes in clinics to see bacterial complication. Differential diagnosis: it is necessary to exclude viral hepatitis A, ornithosis, malaria, typhoid, trichinosis, measles before appearance of eruption, brucellosis, hemorrhagic fever in initial period, pneumonia, acute respiratory viral disease of our etiology, and hypertoxical form, inhalation, anthrax, pulmonary form of plaque. The symptoms and signs of inhalation anthrax, laboratory confirmed influenza, and influenza-like illness from other causes. Like comparative, yes, this influenza, again, elevated temperature may be the same. Fever and chills, less often in influenza, less often in other forms. Fatigue, malaise, again, in inhalation and anthrax 100%. And here maybe more, may not be. Coughing, minimal or non-productive, all the same. Shortness of breathness is seldom. Influenza still happen, but seldom, and often in anthrax, for example. Chest discomfort or pleurotic chest pain, maybe in all of them. Again, we talk about more often and less often. Headache, more expressed and more often in influenza. Myalgia, more often in influenza, but maybe in other forms too. Sore throat, influenza, other acute respiratory viral disease. Rhinorrhea, more typical for influenza. Nausea and vomiting, Not typical by influenza, but maybe in about 12%. Abdominal pain, again, maybe sometimes. Prophylaxis, common and special. Common, rise of stability of organism to catarrhal diseases, WAC, vitamin therapy, specific introduction of inactivated vaccines, subunit containing only H and N antigen, INFLUVAC, for example, or split like Fluarix and Vaxagrupal, wherever you may use any vaccine, Russian, Indian, Holland, France, just vaccinate. At usage of split vaccine introduced in 2 and 6 time or 6 by others acute respiratory viral disease less often. Emergency prophylaxis, usage of remantadine, arbidol, adapramil in preventive dosage and internals will be utilized by 0.25% oxalinic and fluoranic of ingredients. By the way, nowadays it's written that oxalinic ointment in nose is not that effective because it has some antiviral action, but it don't give ciliary epithelium work properly. Rhinoviral infection. The virus, rhinovirus, it has a lot of serotypes, incubation 2-3 days, beginning of disease acute, current acute, main on clinical symptom catarrhal, weak intoxication is weak, duration 1 to 2 days, febrile temperature or normal temperature, catarrhal of the phenomenon expressed since the first day, rhinitis, plentiful serous secretion, nasal respiration, mesial of laboratory, dry cough, maybe weak hyperemia of mucous membranes, main syndrome rhinitis, injection of ice, injection of vessel of sclera, eyelids, tearing, maybe. Parainfluenza, 10-20%. The virus Paramyx severity has 4 serotypes, incubation 2-7 days, more often 3-4 days, beginning of disease step by step, subacute current, main clinical syndrome catarrhal, weak or moderate intoxication, fever 37-38 can be kept durably, catarrhal manifestation expressed since the first day, hoarse voice is present, rhinitis, stuffness of the nose, dry barking cough for 12-21 days, yes, maybe for a long time, for 3 weeks is for long, moderate hyperemia of mucous membrane, leading syndrome, laryngitis, less often false group, increase of lymph nodes, really sour. Adenoviral infection, 5-8% of all acute respiratory virus disease, has 49 serotypes, incubation for 14 days, beginning of disease step by step, currently injury and wavy, main clinical syndrome catarrhal, intoxication moderate, fever subfebrile or febrile, duration 8-10 days, catarrhal manifestation are expressed in the first day, rhinitis, plentiful mucus secretion, state of mucus, hyperemia of tonsils and back wall of pharynx, lungs, dry rails at bronchitis, it may be rather often, carrying syndromes, rhinopharyngoconjunctivitis, again, nose, pharynx, tonsils, conjunctivitis, plus tonsillitis. Lymph nodes can be polyadenitis, yes, generalized lymphadenopathy may be, or just in several groups, lymphadenopathy. Liver and spleen are enlarged, damage of the eyes up to keratoconjunctivitis, damage of internal organs can be ananthema or diarrhea. So much more symptoms. We have rhinitis, pharyngitis, tonsillitis, conjunctivitis, hepatosplenomegaly, diarrhea, polyadenitis. That's about adenoviral infection. This is, again, kid with adenoviral infection. You see why conjunctivitis, rhinitis, pharyngitis with tonsillitis, respiratory syncytial infection. One serotype, but there are a lot of subtypes. Incubation 3-6 days, beginning of illness step by step, curing subacute, sometimes lingering, main syndrome catarrhal respiratory insufficiency, intoxication moderate or weak 2 to 7 days, fever moderate or normal, Collateral of the phenomenon expressed and amplified: rhinitis, stiffness of nose, scanty secretion, cough, dry, attacks morbid, 2 for 3 weeks, mucosal, weak hyperemia, lungs dry and less often most trails, pneumonia, rather often here, bronchiolitis, carrying syndrome, bronchitis, bronchiolitis, bronchospasm. Sometimes maybe signs of toxic hepatitis of the liver, but it's rather seldom. SARS. Again, it's a bit old lecture about all types of coronavirus. About COVID to write is about it a bit earlier because first wave of COVID and now the waves that we have now is quite different, and I guess we will have some other waves with some other clinics, and so what stem will dominate, then we'll see what to write here. But for the moment, we talk about an old stem of COVID. It's SARS, coronavirus of new group. It's similar to nowadays COVID-19, but still a bit different. Incubation 2 to 7 days, or maybe about up to 10 days. Acute disease, acute beginning. Current of disease acute. Express intoxication 5 to 10 days. Fever 38 and higher, catarrhal manifestation moderately expressed, rhinitis possible in start of illness, cough dry moderately expressed, lungs with 3-5 days of illness, signs interstitial pneumonia with generalization, main syndrome bronchitis, acute respiratory distress, damage of an eye is rare, damage of internal organs, frequently diarrhea in a start of disease, avian influenza, virus of influenza A, H5N1, H7N7, beginning of disease acute, current of disease acute, main syndrome fever, respiratory failure, intoxication, strong duration 7-12 days, fever 38 degrees and higher, cough expressed, damaged lungs since 2-3 days of illness, main clinical syndrome lower respiratory tract damage, the increase of liver and spleen is possible, damage of internal organs, maybe diarrhea, hepatomegaly, kidneys, leukolymphotrombocytopenia. Again, avian flu happen worldwide. Mostly it comes from China, but maybe in Egypt, well, in African countries, even, you know, rather 39 cases in Netherlands, not that small case. It may be spread to other countries through traveling. It's a bit of how it goes, and again viral attachment. Well, that's all. Still, read books, please. Read books. Read books. Read modern literature. Treatment of all this disease for the moment, like except of influenza, we don't have effective treatment of other respiratory viruses. We have some drugs in Russia that we use, but they're used only in Russia and don't have big clinical research to prove it effectiveness and spread it worldwide. So maybe they help, maybe no. We don't know for sure because research are rather of not that big. But in Russia we have these drugs. I guess in India you have some of your drugs. But in most world, respiratory viruses except influenza are not treated. Sometimes even influenza even not treated because the doubt of effectiveness of antiviral treatment. So pathogenetical treatment and symptomatical treatment is used. So that's all. Bye.